No.
Good. All right, thank you. Hello, I'm Bob Collum, the city manager here with the city of Roanoke, and thank you for joining us. This is the latest in our series around Vaccinate Roanoke, and what we have been doing over the past few months is actually pulling together a group of individuals from a variety of different backgrounds to focus in on specific areas of information about the vaccine. We always include as a part of these a section of our city council, and we're joined with two council members here today that in a few moments we'll introduce. Let me give you a little bit of background that previous versions of this have included a broad conversation with the Department of Health and with our mayor and one council member. It has also included one that was focused on our Spanish speaking community, was actually delivered exclusively in Spanish. And we also had one recently that focused on the African-American portions of our community. And this one today focuses on the COVID vaccine and questions that may exist among our immigrant population and those in our communities that are facing some kind of developmental or physical disability or challenge within the community. And so we're going to get started again, just like all of our others. It's really designed to be very much a conversation. And so the intent here of what folks will hear is questions that have arisen in the delivery of the vaccine from these different groups and our effort to provide some answers to those. All of our answers come from either the experience of the individuals that are represented on this panel, or they come directly from the Virginia Department of Health or the Center for Disease Control. So those are our resources. And somewhere toward the end of this, Tiffany will identify some additional ways in which you can connect to some of those resources. So at this point, let me take a few moments to have our panelists introduce themselves, and then we'll get into it. So Karen, if you would like to start with your introduction.
Sure. My name is Karen Harney. I'm Executive Director of the Blue Ridge Independent Living Center. We are a nonprofit organization, cross disabilities. So we work with individuals with all types of disabilities. We assist individuals with disabilities to be independent in the community. And then we also work with the community to make sure that it is accessible to individuals with disabilities. We've actually been in existence for 30 plus years. And I'm proud to say that I've been the executive director ever since we started. Of course, I was 12 when we started. So, but anyway, that's who we are. Glad to be here.
Very good. Thank you, Karen. Thank you for joining us. Ahoo, if you introduce yourself.
First, my name is Ahoo Salem, and I'm the executive director of Blue Ridge Literacy. Blue Ridge Literacy is also a nonprofit, but we offer English literacy services to adults in our community. Typically, 90% of our learners are non-native English-speaking adults. That would be immigrants and refugees that live in our community, and another 10% are American-born adults who want to improve their reading and writing skills. To give you an example of how many people we served, last year we had around 300 learners representing 57 countries of the world, including the US. So the top countries represented were Afghanistan and Mexico, followed by Democratic Republic of Congo, Honduras, and Haiti. As you can see, we see a very diverse group of immigrants in our services, in our classes, and we get to see them nearly every day at a different range of programs. Same as the rest of our community, our learners have different backgrounds, different life experiences, different levels of education, English proficiency, and with that goes different levels of access to information in English and in their mother tongue, an important factor in our in the continuation of our conversations.
Great, thank you, Ahoo. Appreciate it. Thank you for joining us. Councilmember Moon-Reynolds, if you would introduce yourself as well.
Thank you, Bob. I'm Stephanie Moon-Reynolds, member of Roanoke City Council, the newbie on council. It is an honor to be with you all today to join in with the living, as well as Blue Ridge Literacy, and one of my colleagues who I've been with a long time, Council Member Bill Bespitz. I thank you all to be able to assist on this panel to bring awareness about the safety of the vaccine to the refugees, immigrants, and disabled community. I want to take the time to express my appreciation, and that hopefully this information will be informative to that community in making their decision on whether to have the vaccine or not. Thank you.
Thank you very much. Councilmember Bestpitch?
Well, thank you, Bob. I am Bill Bespitz. I have been a member of Roanoke City Council for a total of almost 15 years now. And during that time, I have seen Roanoke work harder and harder to be a welcoming community, to include everyone. We still have work to do. Don't get me wrong. We're not perfect. But I think this is one more example of the things that we try to do to make sure that no one in our community gets left out. People who may have trouble with language barriers, people who may have trouble with mobility issues, we want you to get vaccinated as well. We want everybody to get this vaccine so we can go back to a more normal life that has been so difficult to live without now for really a full year that we've been in this situation. So please listen carefully. If you have questions, I hope we can answer them. And I hope you will do everything you can to get your vaccine as soon as you.
Thank you, Bill. Ahoo, we'll start with you with kind of the first question. So if you would maybe share with us sort of what you're hearing, maybe top of mind coming out of the community that you interact with, and we'll kind of talk a little bit about some of the information that we're aware of to respond perhaps to some of those questions.
Absolutely. So before I start with specific, I will give everybody a little background. When we decided to have this conversation, this recording today, I started joining our online and in-person classes to see what are some of the common questions among our learners. Well, as I mentioned earlier, our learners are diverse, and I did see that diversity among our learners, their questions, and their status regarding the vaccine. We have some learners who fall within the age bracket that have already received the vaccine. We have learners whose spouses have received the vaccine because of the job they have. We have some learners who are really eager and waiting to get the vaccine and had all these questions about what should I do. And then we have some other learners who prefer to be waiting for a little while or actually are not 100% certain what they want to do. So one of the first questions that I heard a lot, and I do think it could be a concern for nearly everybody in our community, is in relation to allergies. How should I do if I have an allergic reaction to the vaccine? Or what should I do if I have had an allergic reaction to the vaccine in the past?
Yeah, that's a great question and has definitely come up. And I'll also come back later on perhaps to talk a little bit about the phasing that's being used for, and you alluded to different people who are eligible and not eligible. And we'll come back and talk a little bit about that toward the end. And so Councilmember Moon-Reynolds or Councilmember Beth, either one of you want to kind of, we've got the information about from the really from the Department of Health and from the FDA regarding vaccines and this question about whether or not a vaccine causes an allergic reaction. And then actually, if there is an allergic reaction to the vaccine, perhaps what the proper response would be. So either one of you want to kind of take that question and provide that information?
Well, I can take it and Bill can add to it. Excuse me. I would say, according to the FDA, there is a remote chance that the COVID-19 vaccine could cause a severe allergic reaction, which would usually occur within about a few minutes to 1 hour after getting the vaccination. Now, during the vaccine clinics, patients are monitored before they leave for about 15 minutes to ensure that they aren't exhibiting any allergic reactions.
Yeah, and that is exactly when you're at those clinics. If you've been in one of those clinics, there's a separate area where you go and you sit. And as you indicated, you're actually monitored by the staff there who will ask you repeatedly during that period if there are any issues, if you're experiencing any kind of dizziness or weakness or anything along those lines. And if so, then they're able to render any kind of aid that's necessary at that time. And after those 15 minutes, they generally feel that you're not experiencing that allergic reaction and you're safe to leave at that point. Bill, anything you wanted to add to that as well?
I think we should just emphasize that it's very, very rare. It's very rare. It can happen, but it does not happen often at all. Some of the things that you might experience could be a little trouble with your breathing. You might have a little swelling in your face or your throat, a very fast heartbeat. You could get a little rash on your skin or something. You might feel a little dizzy or weak for a little while. Those symptoms, those allergic reactions have been shown so far long-term effects. It happens for a short period of time. And of course, there are other side effects as well. I was already fortunate to be able to get the 2 vaccines. And what I found was the next day I was just very sleepy, especially after the first one. I couldn't stay awake. I would get up and be up for 2 or 3 hours, and then I just had to lay down and take another nap for a couple hours. And so these kinds of things may happen. But especially if you have not had trouble with serious allergies in the past. And I'm not talking about a little hay fever, you know, when the pollen is out. I'm talking about severe reactions, sting or whatever. You might want to check with your doctor and be sure. But if you haven't had those kinds of serious allergies, the chances are very, very remote that you would ever have any problem with that at all.
Yeah, and I think you know, one of the things that everyone has noted is that there tends, if there is a reaction, even a mild reaction, as what has been described, it's tending to be more common with the second dose of the vaccine. So don't be surprised if your first dose was great and your second dose made you a little bit more fatigued or maybe saw some fever. The guidance that's provided by the Department of Health does indicate, though, if those symptoms progress for longer than a day or two or get significantly worse, it's at that time that you do want to call your doctor and seek some additional advice. So thank you, Ahoo. Thank you for the question. And Bill, yeah, go ahead.
Just like any time, if something really serious is going on, I mean, if you're really feeling a serious problem, dial 911. Don't hesitate. Call 911 and let them help you as soon as possible. It may turn out to be nothing, but it's better to be safe than sorry.
Yeah, absolutely. Absolutely. Thank you. Thank you. Karen, would you like to kind of take the next question that you might have that you're hearing as you again interact with your clients and the folks that you
Sure, Bob,
interact
thank
with
you.
on a regular basis?
Some folks with disabilities are wondering if having a disability alone puts them at a higher risk for getting COVID-19. So I'd love to hear what kind of response we might have regarding that.
Sure. And, you know, I'll take the first stab at this and then perhaps have Bill and Stephanie kind of join in. You know, for the most part, the guidance that's being provided out of, again, CDC, FDA, and the Department of Health is not that having a disability itself causing any greater risk of getting COVID or even any kind of severe reaction to it. There is one exception to that, which is Down syndrome, which they do acknowledge may put you at higher risk of getting, not necessarily getting COVID, but getting very sick from COVID. And it's for those reasons, actually, that the folks with Down syndrome have been elevated in access to the vaccine. We'll talk a little bit later about the list of conditions that are pre-existing health conditions that the health department does recommend that you get the vaccine for sooner rather than later. But really, as far as any kind of underlying disability or physical challenge, none of those other than that noted Down syndrome seem really to put you at greater risk of contracting COVID. Some of the underlying conditions that we'll talk about a bit later do put you at some greater risk of complications associated with it. Bill or Stephanie, anything that you would want to add to that information?
No, sir. I think you've covered what I would have said. Yes, sir.
Very good.
Good.
Thank you. I'm going to turn now to Bill and Stephanie with, you know, you've got two folks here, and one in Ahoo and one in Karen, who deal with, you know, a really significant part of our community and a part of community that has these kinds of questions and different experiences. Any questions either of you might have for either of them and what they're hearing from the folks that they interact with?
I had the pleasure of talking with Karen earlier before we got together, and I was asking her with regards to the disabled community or how they're coping their coping mechanism, how they're coping in the last year with more outside contact, for instance, no computers to even register. How is Blue Ridge Independent Living Center working with that particular group? So I'll ask that now if she don't mind answering.
I don't mind at all, Stephanie. Thank you. Yeah, Stephanie mentioned the fact that, there are a lot of folks with disabilities that for whatever reason do not have access to the internet. It may be that it's not affordable to them, or they may not have a device to get onto the internet. So what we've been doing is checking with our consumers by phone and just, making sure everybody's got everything that they need. One of the things that we heard early on was that an individual's family was not able, and this was early on back in March, they were not able to get to the grocery store when toilet paper was on the shelf. And so luckily, we had purchased a lot of toilet paper. And what we did was we just, put several rolls in a bag, and just one of our staff went out and delivered it, contactless, left it on their porch. But that was one of the things. And we know that people are getting masks from various places. But then when the CDC came out and said that people should be double masking with a disposable mask and a cloth mask, we realized that I'll be able to afford to purchase those cloth masks. So we just mailed out over 500 envelopes containing 5 masks each to all of our consumers so that they could do the double masking. So it was very interesting. Our administrative assistant's office was just filled with trays, and you could just see a little face in there as she's busily putting labels on the envelopes, but felt like that was something we wanted to do for individuals. So
Very good. Thank you, Karen. Bill, do you have a question?
I'd like to go back to a couple of things that Ahoo said and see if she can kind of explain a little bit more. I think you mentioned that some people are not sure, or maybe they've already made up their minds that they don't want to get the vaccine, or at least not yet. And you said, I think, that besides the United States, you work with people from around 56 different countries in the last year. Are you seeing any differences based on the countries that people have lived in before, that people from certain countries seem to be more reluctant, or is it pretty much across the board? And then finally, what kind of reasons do you hear people giving for why they might not want to take the vaccine?
These are really good questions, Bill. Now, some comments with, a certain amount of our learners, and I do believe I might have seen a pattern, but if it really represents a representative enough of a quantity of people to actually be meaningful. But I have certainly seen a little bit more hesitation among our learners who speak Arabic, or learners who are now, I can think for some of the reasons of our other learners, like let's say the majority of learners who come from Afghanistan, I can think back about the prevalence of COVID in their own home country, the fact that it did hit Afghanistan quite hard, same as my home country, Iran. It did hit Iran it is still hitting Iran very hard as well. And when that is happening in your home country and you keep hearing about it, you might be a little bit more aware of the dangers that come along with the virus, and also the understanding that a vaccine is really a luxury and a good thing to have access to. So maybe that can help people make up their minds, but I really cannot go beyond my general observation and assumptions. However, the questions, it seemed to me that the people who had more questions or still had more concerns that would perhaps prevent them from wanting the vaccine as soon as it is possible were those who have not been in an environment that talking about the vaccine, a dialogue about the vaccine, was part of their day-to-day interaction. now we can understand it might be difficult to have access to this type of information in English, which is very prevalent here, host society, but maybe they just don't have that as much on their everyday activities in general, and perhaps not that much in their own mother tongue. I'm not 100% sure about that, but I think that could be a reason.
Yeah, and
and
I think,
factor.
and one of the items, and Tiffany has just put this up on the screen to kind of pick up on what we were just talking about, Ahoo, is that, the CDC and the Virginia Department of Health have actually gone to fairly great lengths to try to include that as much information as possible is included in as many different languages as possible, to remove kind of one of those sort of barriers so that individuals and their families can actually talk about these kinds of things, and be able to access information in a language that perhaps they're more comfortable with as they go through, which will help that piece. Two other items I would mention based off of the questions that you all were just talking about is, in particular with our Spanish speaking residents. And of course, we've got a particular outreach group that's actually working on that side of the community as well. And we just actually last week had meetings with representatives of the consulates from Mexico, Guatemala, Honduras, Colombia, and El Salvador. And they're actually working with us out of Washington, D.C., where they're actually contacting folks here in Roanoke that come from those countries that they have a relationship with, and helping them get registered or share additional information with them, just as one more way perhaps that they can hear from a trusted individual about the efficacy and the safety of the vaccine. So that's also been one way we try to really address that type of barrier, I guess, as we, at least the language barrier, as we try to respond to those. And then the other item that was mentioned, obviously, as Bill had mentioned earlier, of course, we want folks to get the information, make the decision about the vaccine, and hopefully that decision is to get vaccinated. We also do know, as you pointed out, Ahoo, some folks are holding back a bit, not opposed to the vaccine, but kind of taking a wait and see attitude a little bit. We do want to make it clear that if somebody does make that choice, it doesn't mean that you can't still at some point register to go ahead and get the vaccine. So you shouldn't feel like, well, if I was in, if I was if I worked in a grocery store and I was in that first tier of individuals that had the opportunity earlier than others to get vaccinated, and I just wasn't comfortable and didn't take that chance. And later, when it opens up to the general public, do I lose that? Do I lose a spot in line? And that's not the case. That folks should decide, if they waited a month and decided, now I'm ready to get vaccinated. I've seen friends get vaccinated. I see that it's safe. I'd like to get registered. They absolutely can do that. They can go ahead and still go on the system and get pre-registered. So I think it's important that folks understand and recognize that as well.
And Bob, could I add that I think that one of the things that I've heard anyway is that people are concerned because the vaccine was developed so quickly, and usually it takes longer to develop vaccines. So that's one reason why some people may not be sure it's safe. What I've heard, and I got this from a very reliable source, that they actually have done more than 10 years of research on this type of vaccine, or this type of virus, this virus, thinking that some virus like this might come along one day. And sure enough, even though the vaccine research that they had been doing, they never actually had a virus to use it with, all of a sudden, this coronavirus showed up, and they have finished the research based on work that they had been doing over 10 years prior to COVID showing up. So it didn't just all happen in the last year. A lot of this has been going on for a long time, which makes us think that they know what they're saying when they tell us it's safe.
And one of the guests that we had in a previous conversation, such as this one, which is a specialist in infectious disease at Carilion, he also pointed out that usually when you're doing trials to develop some kind of vaccine or some kind of therapeutic or something, that you're really kind of struggling to find folks that might actually have what it is that you're trying to get people from having. Well, obviously, globally, there are millions of people, unfortunately, that currently have COVID. And so the amount of people they could actually have testing the vaccine and the availability of that was substantially more than normal. And that allowed them to advance further on it. And also, and I know you all know this, and they have shared this repeatedly, and it's out specifically on the CDC page, as well as maybe the FDA page. They were very careful as they developed it to ensure that there was diversity in the folks that were being tested, that were testing the vaccine, so that they could, with clarity and definity, be able to say, someone actually was Hispanic, that yes, that has been tested on folks that are Hispanic, or someone was African-American. Yes, there were African-American individuals that agreed to actually go through the vaccination testing, so that it was as broad a cross section. The one exception to that, of course, as you all know, has been young folks, kids. That has not yet been. So that's why you're seeing the vaccines available at this point to folks 16 or 18 and older, because they're still working through the vaccine for children. Karen, another question maybe that's coming up from folks you're interacting with?
Yeah, so some folks with disabilities use a personal attendant to help them with their daily living activities, and we're being asked how those individuals can get a COVID vaccine. Some of the personal assistants work for not only one person, but maybe two or three, so they're going from house to house to house. Some of the assistants are coming through home health agencies, and then some of those assistants are family members. And so individuals are wondering how those individuals get their vaccine.
Yeah, that's a great question. Stephanie or you or Bill, either one of you want to take that one?
I'll yield to Bill on that.
Well, I think that is something that, again, like so many things with this, not completely sure yet, but they could be considered an essential worker, which is the phase that we're in right now. So even a family member, it doesn't have to be somebody who's coming in from the outside, but even a family member who may be assisting someone with a disability could get the vaccine sooner, because they may not be able to stay in the house all the time. If they're taking care of someone, but then they have to go out for various reasons, and they may come in contact with different people, that should be a reason why they could be considered an essential worker, even though it's their family member, and it's not really a job for them. They do it out of their love for the one that in their family is suffering or dealing with the disability. So it's something that I think people should check with their doctor and see how they can help to get on the list for essential workers.
And Bill raised a good point, that obviously those folks that work in that industry, if you will, home healthcare workers and so on, they were included in that first phase, and therefore were eligible. Individuals that you raised, Karen, and that Bill just talked about, which are, again, family members, or it may just be that they take care of that one person, or others and stuff may not automatically have been included in that group, but certainly may be eligible. And I think Bill's advice is spot on. Talk with your healthcare provider, be able to talk with somebody at the health department, check in on that pre-registration list, because it continues to expand as they go along, would be the best route to.
Great.
That's what I would say too, Bob. I was thinking, when Bill was mentioning that, I would think that would be in a healthcare facility in that category, and would do the same thing as you're saying, check with the health department, check with CDC or your doctor's office, because you are coming in contact with someone who may have those underlying conditions or that age. And so you wouldn't want to be systematic and cause them to be tested positive or to have COVID. Yes.
Yep, absolutely. Absolutely. Well, we're gonna start to wrap this up, but I want to give Ahoo and Karen one more opportunity with any other questions that have come up that your folks that you're interacting with, again, that you hear that we haven't been able to kind of touch on yet, that you really think is important.
So 70% of our learners are women. So this next question, was somewhat top on their priority list, and that is, what should I do if I'm pregnant? Can I get the vaccine? And also, what if I get the vaccine and I don't know I'm pregnant already?
Yeah, Stephanie, you wanna take that one? And
I was thinking about that. What do you do? You know, when you find out that you're pregnant, there has been no significant safety issues reported for pregnant women. The CDC, the FDA have stated clearly that all pregnant individuals who are eligible should have the choice to receive the vaccine.
Yeah, and I think, as Tiffany is showing up on the screen, to make that even more significant is where there haven't been those known safety issues, there are known increased risks for severe illness. So it may be even more important that you seek that out. And as has always been the case, and we've reinforced this repeatedly, obviously, someone should consult their healthcare provider with that. But at this point, that certainly seems to be something that can be done safely. And Ahoo, I'm glad you mentioned that one, because we've also heard from the health department that, where they've interacted with folks and there's been some resistance to seeking out the vaccine, a lot of it has been around women of childbearing age that have questions about, the efficacy, not only the efficacy, but also the safety of that. So it's really important that they actually seek out that advice from the health department and from their healthcare provider, because again, they are at some increased risk as they're going through their pregnancy from COVID itself. So thank you. Karen, any last questions that you had?
Yeah, I was wondering where individuals could find the list of the conditions that might put them at the top of the list. I know we discussed earlier that being a person with a disability doesn't necessarily make you more prone to get COVID-19, but if you have an underlying medical condition, that may bump you up on the list. So just wondering where folks can find that. And I see Tiffany has brought that up for us.
Yeah, that's a great question. And what Tiffany is showing on the screen is from the Centers for Disease Control, so from the CDC page, and it's the underlying conditions. And what the significance of that is, as you've noted, Karen, is that those individuals that are 16 to 64 who have underlying health conditions that make them at greater risk of severe illness associated with COVID are eligible in the earlier phases in what's called phase 1B of the vaccine. Up until really very recently, the vaccine in 1B has been focused predominantly on essential workers and on those 65 and older. With the Johnson & Johnson vaccine coming online and just the overall increase in availability, the local health district has been able to start moving in the direction of having more individuals, those 16 to 64, that have these underlying health conditions, along with some further essential workers on the list. So definitely folks want to take a look at it, and included things, and it was shown on there again, cancer, kidney disease, smoking actually is one of those underlying health conditions, type 2 diabetes, asthma, cystic fibrosis. There's a fairly lengthy list of those. And again, the reason those are identified is because they know that places the individual at greater risk. And so it's even more important that they actually gain access to the vaccine. And that information, again, is out there on the CDC website as well. Well, again, I want to thank you all. I know this barely scratches the surface of what I'm sure everybody is, dealing with as they go along. I did want to acknowledge, and it goes back to something I think Bill indicated earlier, which is, we're not, we and the Department of Health, CDC, all these others are not perfect. This is, as all of the doctors remind us regularly, that this is a virus that has only existed now for about a year. And so therefore, they're still learning a lot about it and reacting a lot to it. We have never obviously vaccinated on the scale that we're vaccinating on in our community, probably ever, as we go through. So they're continually learning things. And there is no question that they're constantly improving the way in which they reach populations that don't speak English, that have concerns, folks that have mobility challenges or maybe homebound. So those are still gaps, I think, in this system, and we should acknowledge those. And a part of what VDH is working on with the localities as well as with their state and federal partners is, how do we improve on that? How do we actually better understand what those challenges are and then try to remove those barriers? And conversations like this are a part of what we're trying to do locally to try to get those facts out there, and also to understand where those gaps might still exist. Stephanie, Bill, any last thoughts or things that you would like to offer up as we begin to close out?
Yes, I would like to say, as it has been noted before, with those who have had have had the first dose of the vaccine, I think it is important, and it has been said that there has been some concerns with regards to people not answering their phones. That we have said it several times, it is important that you take the time and answer your telephone. A lot of people are not doing that. Until we get everyone vaccinated, please, please, please answer your phone. The call often comes in a spam, so look for it. But take the time, or either follow back up if you have not heard when you've had your first shot, to see when am I to get it in case you did miss getting that second vaccine.
That's a great point, Stephanie. Thank you. Thank you. Bill?
Well, and I guess I would point out a little bit of what I see as the good news, bad news in our situation right now. The good news is that we're getting more and more vaccine every week. And while the supply is going up, I think we can be very proud of our local health district and others in the community that have come together and done a very good job of making sure that if we get 1,000 vaccines, 1,000 vaccines go out. If we get 8,000 vaccines, 8,000 people get vaccinated. So we've done a good job with that. That's the good news, and it's getting better every day as we get more and more vaccine from week to week. The bad news is we still need more, and there's still a lot of people waiting, and some of us have been waiting for a long time just to try to get our lives back to normal again. Please be patient. Please remember that we haven't forgotten anybody. Everybody can get on the list and they'll get to you in due time. So please be patient, continue to wear the mask, avoid crowds as much as you can, stay home and wash your hands. And one last thing, if you're listening to us and you know someone who may have a language barrier or may have some cultural reason why they're suspicious, reach out to them. Let them know that they should get involved. If you know somebody who has some mobility issues, dealing with a disability that may make it more difficult for them, help them out. Reach over to your neighbor or your friend or somebody across town for that matter, and help them take advantage of the opportunities that are there for all of us. And I just want to thank, speaking of different languages, I just want to thank Dr. John Day Arboleda for being our interpreter today, so that those who may have some hearing loss, mine hasn't gotten quite bad yet. I do have the hearing aids in, but for those who have even more trouble than I do with hearing, it's great to have the interpretation going on. Thank you.
Thank you, Bill. And I definitely concur. And yes, just to put a highlight on something you said, that, you know, at this point in our area, so just in Roanoke County, City of Roanoke and Salem, you know, more than 70,000 individuals have received their first dose of the vaccine. So if you think about it, the health department has only been administering these vaccines for about 2 months now. And to finally be at a point where we already have 70,000 first doses is a pretty amazing undertaking. And we still have a long way to go. But it's a really good first step. And to your point, and we always end each one of these the same way, and you already have set the stage for that, which is that we remind folks, whether you've been vaccinated fully, whether you have received one vaccine dose or you haven't gotten your vaccine yet, it is essential that everyone continue to practice the mitigation measures that have been put in place in terms of face masks, social distancing, limiting gatherings, and so on, until we reach that point at which all of our public health officials tell us it is now safe to actually begin stepping away from those. It's really critical that we do that as well. I want to thank you again, Karen, as well as Ahoo, for joining us and certainly sharing with us the concerns and questions that you're hearing and some of the answers that you provided as well. I greatly appreciate that. Obviously, Councilmember Moon-Reynolds and Councilmember Bespitz, thank you all as well. And as mentioned already, for our interpreter, very much appreciate it as well. And for those that have joined in, we will continue to do this as we find different ways to reach out, and would encourage you to continue to keep keep informed with our Vaccinate Roanoke effort, as well as the Vaccinate Virginia effort as well. And we'll keep you in as much information as we possibly can. So thank you all very much.
Thank you.
Thank you.
Thank you.
Bye.
Bye.